All right. So, I want to talk a little bit about lower back pain and the difference between core strength or lower back strength and you know, having that bracing ability compared to trying to control your lower back spine. So for those of you that have recurrent lower back pain that just keeps on coming back, or back pain that always comes back with a particular tilt, or you know, every time you do deadlifts or something like that, we want to talk about what it is that that keeps on making it come back all the time. And most of the time, it's not a matter, and you know, it's funny because most people have, like, well, someone says, well, my core strength is strong. Don't tell me it's core strength, I've got a 3-minute plank hold. Well, guess what? Plank hold is not a really good measure of how stable your spine is. It's your endurance of your core strength, not stability. So the reason you get lower back pain coming back all the time is because you don't have a stable spine, not because you have a weak core. Can I say that again? Or just rewind and play that again? Because if you have strength, if you don't use the strength in a stable way, then it's weak, it doesn't work. You have to put your strength in a stable position for it to fire and actually work for you. So, for those that say, I've got weak glutes, I've got weak hip flexors, I've got weak quads, weak hammies, that, if anyone tells you that you're weak, they are lying to you. Unless you're physically, you've never, like you don't actually have any neurological function through a quad, then your quad is always going to be strong. It's just got to be put in a position where it can fire. Okay? If you have any questions about weakness and stuff like that, you can email me, because no one that's weak, if you're functioning correctly, it will fire correctly. So, how do we put our pelvis and our lumbar, our lower back spine and our pelvis in a position which can fire? So, if you're someone with an anterior tilt like that, or a posterior tilt, then automatically you're in a position where you cannot fire. So for those of you that say, I've got bad posture, or for those of you that have bad posture, you will create a weakness or an inhibition. So you will feel weak in a certain place. So for people that have a really rounded mid-back spine like that, will create a dominance of a dominant sort of anterior pelvic tilt and a kyphotic mid-back. That's going to make these feel weak. They won't fire because they're in a crap position. So, for this, a person with poor posture might come to me with lower back pain because they've destabilized their lower back and their glutes are weak, and they go to the physio. Physios are renowned for it, and they'll tell you, you've got a lazy glute, lazy ass syndrome. If you don't fix your posture and you don't put yourself in a position which makes this fire, then it's not going to work. So treating the lumbar spine and getting your lower back rubbed and putting the roller on it and doing all that sort of stuff isn't going to work. You need to fix your posture. So you treat your lower back pain by treating the postural dysfunction. So that's one way. You destabilize and you lose control of your lumbar spine because your posture's no good. But a really simple exercise, and mind you, just before I keep going there are heaps of different causes for creating instability in the lower back. So if you have really tight quads, that destabilizes the spine. If you have a really crappy mid-back and you're kyphotic, that destabilizes the spine. If you have overly tight anterior core structures, that destabilizes the spine. You have to have an even sort of environment the whole way around. Really, really quick exercise that I want to show you. The first thing you have to do is make sure that you can tilt your pelvis. So you have to roll, be able to roll. Can you see that? So you have to be able to roll your pelvis. And by rolling your pelvis, it means you're not engaging your lower back spine to do it. You're using your pelvis only. So for people that do this and this to try and move their pelvis, you're moving your lower back to do it. You need to be able to keep your spine neutral and just be able to control your pelvis using just your pelvis. Okay? The next step, if you can do that, the next step for you will be to then roll your pelvis using just not your lower back, and then try and lift one vertebrae at a time off the ground. So it's almost as if you're trying to tilt the pelvis, and you just keep on tilting until you're starting to lift the spine off the ground. And then as you lower it, try and lower one vertebrae at a time as well. Until you get to a point where that's smooth, controlled, and not painful, then, and you do that again repeatedly every day. If you have lower back pain, that's a good way to start teaching your brain how to stabilize that lumbar spine. The next step is to find out where you're tight. Fix the tightness, keep doing that exercise, and that should help your lower back pain.